Today, we're going to introduce you to the folks at Caldwell Sleep Center in Hudson. Let's go on a tour. Caldwell Sleep Center is located on Pine Mountain Road in Hudson, a familiar sight with the mountains in the background, Grandfather Mountain, and right across the street from Hudson Middle School.
Hi, I'm Katrina. Come on in and let me show you to the sleep lab. When you arrive to the sleep center, you'll be greeted at the window by a technician and they will do your registration. And here is Cindy.
Hi, I'm Cindy and I will be doing your registration today. If you don't mind, just fill out this questionnaire, and then there is also a paper behind it. It's just a short form if you'll fill that out. So I just wanted to let you know that we will do our best to accommodate your bedtime, but there are certain criteria that we do have to meet. And so if you will just bear with us and work with us, we'll work to get your bedtime as quickly as we can and as efficiently as we can and get the criteria that we need as well. So if you will, just go through this doorway. Katrina's going to show you to your room, and we hope you enjoy your stay with us tonight.
Hi again, let me show you to your room. All of our rooms are private and have their own restroom with handicap accessible shower. Also, our rooms come equipped with a ceiling fan, a full-size bed, phone, TV, Wi-Fi internet access. And one of the few points that we need to bring is that upon arrival, you will need to bring something comfortable to sleep in because we do have more than one patient. And also, if you have any nighttime medicines that you have, you want to bring those with you so that you can take those. Now let me take you out here. And one of the many questions that we get asked is, what do we as technicians do while our guests are sleeping? And I'm going to let Miss Cindy answer that question if you'll go back to her.
Hi, thanks Katrina. So I'm going to address what it is that we put on you and what the sensors do and what we do while you're sleeping at night. So if you would take a look at the screen here, this is a screen that as techs we monitor throughout the night. Everyone thinks we look at you while you're sleeping. Your picture on our screen is very, very small, and that's so that the doctor can go back and look at anything that we may make a note of. Other than that, we are monitoring what your oxygen level is, your heart rate, your body position. We're also monitoring your heart on our screen to see if there are any type of abnormalities. We're looking at your breathing patterns down here. This little squiggly lines in the middle, as some people would call it, are your brain waves. And so we have to monitor those to know if you're awake or asleep, and then also what stage of sleep you are in. So this is basically the screen that we look at night. We complete the study, and then our board certified sleep physician will interpret the study in the next several days. You will either follow up with him for your visit, or you will go back to your referring physician to get the results of your study. So either way, you are going to have a board certified sleep physician interpreting your study. So that's what we do at night. So the questions always ask, do we look for anything other than apnea? So I'm going to let Katrina answer that question for us.
Absolutely, but most of our patients do think that we are just monitoring for sleep apnea. However, there are numerous other sleep conditions that we are monitoring for, such as chronic pain, restless leg, insomnia, frequent trips to the bathroom during the night, REM behavior disorder, sleep talking and sleepwalking, and just so many more. Cindy, I think that we should address a few other questions our guests may have.
I agree. We get asked so often, do I have to stay overnight? And if so, how long do I have to stay?
And the answer to that question, yes, it is an overnight study. For the most part, if it's a diagnostic study, basically we're required to have a minimum of 6 hours of recording. Sometimes if it is a split study or a titration study with treatment, then it may take a little bit longer. But we are always able to get our patients up and out of bed in time to make it to work or to school. We do kids as well. So, we have our showers here. You're more than welcome to get ready here before you go to work.
Great, wonderful. So staying overnight here at the center, can you share about how safe it would be?
Yes. Once our patients have arrived, we, as technicians, make sure that the building is locked up. We have a camera focused on the front of the building so that we can see any activity outside that's going on. We also have panic buttons that we carry with us, so if there is an emergency or any response needed, we have access to that quickly.
Good. All right, so I have a lot of people that ask this question, especially the ladies. Do I have to cut my hair? I know you're going to be putting that stuff on my head. Do I have to cut my hair?
No, absolutely not.
Good.
We do have to access certain areas of the scalp and the head region. However, it takes a little extra cleanup time in the morning, but it's not an issue. But if you do wear hair pieces, male or female, they might have to be removed.
Okay, another big question is it going to hurt? Are you going to be using any needles or anything else that hurts?
No,
Good.
absolutely not. Basically, we're putting electrodes on to monitor the heart, the leg movement. We have a chest belt, a stomach belt that monitors respirations. And again, most of the rest of the electrodes are on the face or on the scalp and just takes a little extra cleanup in the morning. Absolutely no needles.
Okay, good. So we've covered that. So the one thing that I have problems with throughout the night is up and down to the bathroom. So with all of that stuff that you're going to be putting on me, am I going to be able to get up and go to the bathroom?
Absolutely. All you have to do is call out and your technician will come to the room. We unhook a few things. You go to the restroom. When you come back, we resume testing.
Okay, wonderful. So big question. What if I do have sleep apnea?
That will be addressed in your follow-up visit, either with your board-certified sleep physician or with your referring physician. And if you do have sleep apnea, treatment options will be shared with you at that time. That may include coming back for a second visit to the sleep center for a titration study.
Okay, so how do I know if I or someone that I love, member of my family maybe, how do I know if they even need to have a sleep study?
There are wonderful clues out there that give you a hint. Loud snoring, frequent trips to the restroom, waking with a gasping or choking feeling, bad breath, headaches, dry mouth, and just numerous things that we look for.
Okay, so I've also heard that if I have if I have had a stroke, or if I have diabetes or hypertension or a TIA, things of that nature, I've heard that I'm probably more susceptible to sleep apnea. Is that true?
Yes, that is true, and also it is true the other way. Sleep apnea can cause some of those symptoms that you're having, the hypertension, diabetes, all of those, that if you have to take multiple medications for any of those things and you're still having issues, it may be coming from the sleep apnea.
Okay, great. So I hope that we have answered some of your questions that you may have about sleep disorders in general, not just sleep apnea, but sleep disorders. And we would welcome you to contact us here at 828-757-8206 to have a consultation with our board-certified sleep physician. And Katrina and I look forward to seeing you in the sleep center.
Yes.
Sleep.